Nectari, I know it for all of us who are going through an experience like this, it's a long story, but just quickly tell us what happened with you and your mom when she ended up going into long-term care.
Yeah, so what I found was my mom's dementia progressing. It was very difficult for her to speak in English. She still had the capability, but it only came when it was push come to shove that she would revert and say something in English, and generally she would blurt it out. And her behavior was quite aggressive because she never really understood what was being asked of her and what she needed to do. And then one day, Natasha, a very lovely nurse in the long-term care center, suggested I stick all these yellow Post-it notes on the wall translating basic activities of daily living from Greek into English. So the staff could come in and actually be able to speak to my mom in her language and be able to explain to her what they wanted of her and what they were trying to do to her. And we found that it was almost like magic. As soon as my mom was able to understand what they were asking and the fact that they were there to actually tend to her and help her, her behavior changed, right? She would smile much more, and it was no longer a sense of aggression because she didn't understand what was going on. And that was sort of the genesis that led us to our translation app.
Talk to me about that translation app. What's it called and how exactly does it work?
Okay, good. So the application is called uCareLINGO. It basically focuses on a couple of key activities. The first one is it translates 35 activities of daily living using both audio and visual from English into 17 different languages. So you think of it now, a home care worker or a long-term care staff or a nurse or physician, anybody could actually use the phone, point to a certain object, whether it's stand, sit, bath, food, are you feeling well, do you have any pain? And that would act, and by pressing the icon, they could create a visual for the patient, but also translate it in pre-recorded languages into 17 different languages. So that's one of the key functionality to help to break down the communication. But another key component of the application is that we built in an AI translator. So you and I could actually be having a very fluid conversation where you're talking to me in English. It will translate it for me into Greek. I in return will reply back to you in Greek, and it will translate it to you in English. So it actually allows and enables the free flow of conversation between two different foreign languages.
Is it being used at hospitals, long-term care homes, nursing homes?
Yeah, so I'm really excited to say we got our first significant order. We have hundreds of downloads. When we first launched the app about 7 months ago, we gave it for free to Canada. We got quite a few good trials and feedback, but I'm very happy to say that the province of Prince Edward Island gave us our first major order. They just placed an order for 250 licenses that they're going to be using in their community and home care organization. So this way, nurses and home care staff that will be visiting patients in their home will actually be able to visit them and use the app in their daily caregiving.
You know, people at home might be watching saying, well, this interview sounds like an ad for your app. But the fact is that this actually helps caregivers, it helps the healthcare system, it helps nurses, and most importantly, it helps the residents in these facilities who need to be able to clearly communicate what they need as patients and as residents. So, please go ahead.
No, clearly. No, I was going to say clearly, I mean, if you look at the numbers, it's really devastating and staggering what's happening on a worldwide basis with regards to people living with dementia. And one thing that hurt me the most is my mom was a very caring and loving person. She was very sensitive. She did a lot of volunteer work. Up until her mid-80s, she would always joke that she's out helping seniors, and she was a senior herself. And then all of a sudden, this very patient, loving woman started to show high signs of aggression. Not just to staff members, but even to myself sometimes when she didn't understand what I wanted or what I was trying to do. And quite frankly, Natasha, what I was able to observe is as soon as a caregiver came in and actually used the application or, you know, spoke to my mom in her language and actually explained to her it's now time to take a bath, my mom was actually able to understand why they were trying to get her out of bed. And you know, it's fight or flee, right? If you don't understand what's happening to you, you're either going to show aggression, and you really don't want to do that. You're scared, you don't know what's going on, or you're going to flee. Unfortunately, frail people, especially people living with dementia, don't have the opportunity to flee. So many times they revert to showing aggression, and that's not good. what I was able to observe is by improving the communication between my mom and her caregiver, she was much calmer. She would sometimes say, no, I don't want to take a bath, but at least she understood what was being asked of her. But more often than not, she was a lot more willing to participate in the care that they were trying to provide to her. And the overall level of care improved, but more importantly, the level of, I guess, aggression, I really hate using that word, but the level of frustration that came out of her really decreased. And that was the winning point in all this.